Okay, on your first question, John, we don't have a big team in the OPT because, as you know, we haven't received the authorization to renew the visas for the international staff that we had in Israel, on the occupied Palestinian territory. So currently, there's no any international staff in the territory. The head of the office have been granted exceptional visas to go to Gaza. He went recently. You had interviews with him, but currently there's not any international staff. With respect to the national staff, they have been fleeing as anyone else in the OPT. There are people that lived in Gaza with their families, and they are not present there. And the staff working in the West Bank do it as better as they can, but as I said before, we need to correct ourselves before speaking up. On as well on this case of the hospital, we did issue a comment on it. I have it in front of my eyes, and what we said is that it seemed to be an extrajudicial execution and in a counter-terrorism operation. But is the information that we had at the moment. We haven't had any further information. That's why we haven't expressed ourselves on this matter again.
Yeah, thanks, John. So I think we addressed this question in one of the press conferences. Look, this reported attacks within the health facilities can only create fear, and people in hospitals should always feel safe. Those should be safe havens where people come to get medical care and should not be afraid for their lives. So if people feel fear to go to health hospitals, to health facilities, hospitals, health centers, obviously that reduces the access to healthcare and can have consequences on the health of the population. Marta already spoke about that health facilities are protected under international humanitarian law, and we keep really repeating our appeal to all parties of the conflict to respect that health workers, ambulances, hospitals, patients should never be a target and should be protected. I'll just give you the latest figures we do have on the number of attacks that, as you know, we are documenting by getting information from different sources. I will repeat again, WHO is monitoring, verifying and reporting these attacks, but we do not attributing blame. We do not have capacity nor mandate to know what weapons have been used and who has committed those attacks. So far, WHO has documented 721 attacks on healthcare in the occupied Palestinian territory since October 7. Out of those 721, 357 attacks in the Gaza, resulting in 645 fatalities and 818 injuries. These attacks have affected 98 healthcare facilities, including 27 hospitals damaged out of 36, and affected 90 ambulances, including 50 which sustained damage. Other 364 attacks happened in the West Bank, resulting in 10 fatalities and 62 injuries. These attacks in the West Bank have affected 44 health facilities, including 15 mobile clinics and 24 ambulances. Happy to send this information by email.
That would be great. Thank you so much, Tarek. And I think Marta has additional information on Jenin, if you could. Thank you.
Yes, just to be clear, I will read out the comment I was referring to that we issued following the Jenin attack. We specifically said that the Israeli security forces claim that claimed that the three men that were killed, were planning attacks against Israelis and hiding in the hospital. The ISF also claimed that one of them had a gun, a claim denied by hospital staff. No exchange of fire was reported. Under applicable international human rights law, firearms may only be used when strictly necessary to prevent an imminent threat to life of serious injury and is otherwise unlawful. The UN Human Rights Office calls on the Israeli authorities to immediately end the unlawful killing of Palestinians in the occupied West Bank, which the office has increasingly documented after the 7th of October, and to provide accountability for all unlawful use of force. If you recall, on the 28th of December, we released a report on West Bank and settlements violence against citizens of the West Bank. We can share with you again, at the time, if I recall correctly, was more than 200 people killed, might be more by now. So we can ask our colleagues in the OPT and the Occupied Palestinian Territory office and share those numbers with you. And let me recall as well that before the 7th of October, already the number of killings and violence in the West Bank was really high and a record number for the last 15 or 20 years. So already the violence in West Bank was striking before the 7th of October, but we can share with you these numbers when we get them. And as well, let me use the opportunity, as we are speaking about OPT flag that you have may seen, we issued yesterday a comment by the High Commissioner on the widespread destruction by Israeli Defense Forces of civilian infrastructure, and how worried we are. So again, let me repeat what it's written in this press release and highlight the Article 53 of the 4th Geneva Convention prohibits destruction by the occupying power of property belonging to private persons, except where such destruction is rendered absolutely necessary by military operations. Destruction carried out to create a buffer zone for general security purpose do not appear consistent with the narrow military operations. And extensive destruction of property, not justified by military necessity, and carried out unlawfully and deliberately amounts to a grave breach of the 4th Geneva Convention. So this was put out yesterday by us, and the High Commissioner is really, really worried about such destruction. Thank you.
Thank you very much, Marta. Moussa, is this a follow-up for Marta?
Oui, c'est pour Marta, merci. Si j'ai bien compris, vous avez dit que vous n'avez pas assez d'informations sur cette attaque. Et là, votre réponse, donc c'est une réponse pour moi générale. Ça peut concerner les hôpitaux à Gaza qui sont attaqués depuis le 7 octobre ou n'importe quel hôpital ailleurs. Mais là, on parle d'une situation spécifique. C'est-à-dire, il y a un hôpital, un commando habillé en médecin, en infirmier et infirmière et en femme palestinienne. Cette vidéo, si vous ne l'avez pas, je peux vous l'envoyer, et a été diffusée dans les télévisions du monde entier. Et jusqu'à maintenant, vous n'avez pas assez d'informations. Et ma question est la suivante. Quel est l'avis du Haut Commissariat, la position du Haut Commissariat de M. Volker Turk concernant une attaque dans un hôpital avec des commandos habillés en médecins et infirmiers? C'est ça, donc c'est ce que je cherche vraiment. Merci.
Specifically on being dressed up or not, I don't have the answer, but I can talk to my colleagues on the willful killing or unwillful killing, or if it's a summary execution or not. What I read is the law. There's not an imminent threat. Arms should not be used, and these people, regardless of they were patients or they were had committed crimes, no one can shoot at a person that doesn't have an arm and doesn't and is not a threat. So it looks like it was done in not the way it should have been done, but again, is that we can say up until now, that what it appears. Thank you.
Thank you very much, Marta. Gabby, was that your hand up and just went back down? Okay. I thought I saw a hand, so I don't see. Oh, there it is again. Gabby, El Proceso.
Yes, thank you so much. Thank you very much, Rolando. Yeah, my question maybe to Tariq or Marta, who is going to investigate who are the perpetrators of the attacks against health facilities and hospitals and health staff? Who is going to investigate? I mean, on accountability. Yeah, thank you.
Yeah. Israel, as an occupying power, has the obligation to investigate any crime it's committing on the occupied Palestinian territory.
I think that's pretty clear. Thank you very much for that, Marta. Further questions for Marta? No, I don't see that the case. So thank you very, very much for joining us here. Tariq, thank you for staying with us. I'll give you the honor of maybe introducing your guest who is going to address an update on the global dengue situation.
Yeah, thank you very much. So we have a pleasure to have again Dr. Raman Velayudhan, who is our lead on dengue. You had opportunity to speak to him a couple of months ago, but we really thought that it would be good to provide you with the update on the global dengue situation. So I'll give the floor immediately to Dr. Velayudhan.
Thank you very much. I hope you can hear me. It is indeed a pleasure to brief you and thank you for giving me this opportunity. Just a brief background, dengue is the most common viral infection transmitted to humans through the bite of a mosquito. And this infection is most common in urban areas and peri-urban areas in tropical and subtropical regions of the world. Majority of the cases are mild, and sometimes there is no symptoms. But for those who have the symptoms, they are usually high fever, headache, body ache, rashes, and nausea. They recover in 1 to 2 weeks' time. But there are cases, especially those who get dengue for the second time, which we call secondary infection. They may need hospital care because they may have a severe dengue and which has specific warning signs. And if we have severe dengue, naturally you need specialist care in the hospital. There is currently no specific treatment for dengue or severe dengue, so early detection and proper medical care is the key, and it definitely reduces the mortality due to dengue. At present, about 4 billion people are at risk of this disease. In 2023, we reported around 5.5 million cases and 5,000 deaths due to dengue in over 80 countries. The situation, the region of the American region was one of the worst hit, and they had recorded 4.5 million cases, one of the highest in history, of which there were about 2,280 deaths. And the cases, most of them were reported from Brazil, which was around 3 million, though the case fatality rate was 0.4%. The main vector of dengue, which is the Aedes mosquito, they have silently expanded their range, and they have crossed many countries, and today they are present in over 130 countries. And this expansion is continuing mainly in the Mediterranean region, southern parts of South America, parts of Africa, and this is facilitated by environmental changes and climatic conditions which are extremely suitable for their breeding. The dengue season is currently peaking in the southern hemisphere, especially in the American region, and the El Nino phenomenon is still ongoing, and the trend of 2023 is continuing at present, and we are quite concerned about it. In the first 4 weeks of 2024, the American region has reported over 373,000 cases, of which 258 were severe and 57 deaths were reported. All 4 serotypes have been detected in the region. Most of these cases are from Brazil, followed by Paraguay, Colombia, Mexico, and Nicaragua. Brazil has one of the strongest region, and it's a real model for many countries, and the dengue cases are reported as suspected, probable, and confirmed. Brazil is one of the 2 countries in the region of the Americas who are going to introduce the new dengue vaccine, Qdenga, which is produced by Takeda, in its routine schedule for children between 10 to 14 in 512 municipalities with over 100,000 population, and they are targeting to vaccinate around 2.5 million children. Now, in terms of WHO's action, considering all these factors, WHO has assessed the risk of dengue globally and has put dengue at a higher level and supporting all countries around the world to control the current outbreak and prepare the countries to respond to any future outbreaks as monsoon and weather patterns change from region to region. WHO is currently supporting countries to plan and implement priority multi-sectoral interventions to control the spread of dengue, such as strengthening surveillance, conducting risk stratification, and prioritizing action. We are also helping countries in training clinical experts and updating their guidelines, strengthening mosquito surveillance and control to guide vector control activities, including community participation. And WHO is also leading the global arbovirus initiative, an integrated strategy to tackle all arboviruses, which includes dengue, chikungunya, Zika, and yellow fever. And this is mainly to address the issue of monitoring risks, preventing, preparedness, detecting and response, and building a coalition of partners. The advice WHO gives to countries is, and partners and communities to work together to be alert and be prepared to detect any transmission of dengue and other mosquito-borne disease in the tropical area. The general population can also lower their risk of dengue by avoiding mosquito bite by using insect repellents or screening their houses, and even especially during the day, because most of these mosquitoes bite during the daytime, and they need to support communities to reduce and eliminate risk, especially reducing mosquito breeding in and around your homes, at places of your work, schools, etc. So I'll stop there. If there's any question, I'll be happy to answer. Thank you.
Thank you very much, Doctor. We have a question for you from, I think Jamil disappeared. So Gabriela Sotomayor of El Proceso of Mexico.
Yes, thank
Go
you.
ahead, Gabby.
Thank you very much for this briefing. What are your main concerns regarding Mexico? How is the situation there? Thank you.
Well, Mexico has recorded a few cases so far, and we really need to monitor. And I must say that Mexico also has one of the very good surveillance systems. I have personally seen it. So they will be able to detect and act on it to control the outbreak. So at the moment, it is not alarming, but we hope things will be under control, and we are monitoring the situation.
Thank you very much, Doctor. We have a question now from Paula Dupraz-Dobias of Geneva Solutions. Paula?
Yes, hello. I wanted to ask about Ecuador because it doesn't, you didn't mention it in the names of countries in South America or in Latin America, but given the El Niño phenomenon, there's been concern that there, as well as in Peru, with the rains and flooding, that the situation may be exacerbated. I also wanted to ask you, and if you have comments about the situation then in Ecuador regarding dengue, but I also wanted to ask about any response by WHO or other humanitarian organizations in Ecuador right now, given the security situation. If you and perhaps any other colleagues could comment on that. I don't know if OCHA or UNHCR are able to comment about the situation in Ecuador.
Thank you. I think later I can provide you the exact figure of dengue because we are still updating our table. As I said, Ecuador is not in the top 5 countries at the moment, but we are monitoring it. We have our staff office based in Ecuador closely monitoring that. Yeah, on the security situation, I will ask other agencies to help. Thanks.
Yeah, using this as an opportunity to invite other colleagues, should you have anything to add on the situation in Ecuador, please just put up your hand. But for the meantime, we'll turn to Isabel Sacco of Spanish News Agency.
Yes, good morning. Thank you. I would like to know on the availability of vaccines, if there are enough amount stocks of vaccines to respond to any outbreak in Latin America, and if it would be a need to expand the immunization programs or regarding dengue. Thank you.
In terms of vaccines, frankly, this question we have to address to the company, which is currently Takeda. They are basically scaling up their production. We are told that they have provided 3.2 million doses to Brazil, and other countries, if they have requested, we really don't know. So this is something we have to get it from the company, and I will try to get it in a couple of days. So we really don't know their capacity at the moment. We know they are scaling up, but they haven't provided us exact figures. And I really don't know which countries are opting for vaccinating, because our WHO recommendation given by our strategic advisory group is to vaccinate children in the age group of 6 to 16 years in high transmission areas. So that is very specific to this vaccine, and so it's up to countries to decide where they want to target their intervention.
Thank you very much. Before we go to the Jamil, Isabel, did you have a follow-up to your question?
Yes, thank you. Tell me, would you or would WHO describe this situation that you are seeing regarding to dengue in Latin America as a crisis, as a concerning situation, or as a normal pattern given the season, the peak, that this is the normal season for dengue? Thank you.
Thank you very much. Actually, this is the season for dengue. There's no question about it, because it's a summer in the southern hemisphere and you have your rains and things, and it is an ideal condition for mosquitoes to breed. This is definitely the season. Now, whether this is going to have a steep increase, we really don't know. We are in the early stages. Now, we know there is El Nino phenomenon happening in the region. We also know that there are places which could have, which had severe drought. In those areas also, people store water and this breeds mosquitoes. And even in flooded conditions, again, it favors the mosquitoes. So we just need to watch how this season spans out in the next few weeks before we can give you any assessment whether this is a really crisis. But at the moment, the trend in Brazil is little alarming. It is increasing, and the government has even declared an emergency, which is already in the media. So yes, it is the graph is definitely high in Brazil, but we hope other countries it may not be so, but it very much depends on weather patterns as well as the transmission by the mosquito.
Thank you, Doctor. Speaking of Brazil, we turn now to our colleague, our Brazilian correspondent, Jamil Shad, has a question. Jamil.
Yes, Rolando, can you hear me?
Yes.
So yes, go
ahead. Bear with me. I have a number of questions on dengue in Brazil. So the first one, Carnival starts tomorrow in Brazil. Is there any specific recommendation from WHO regarding dengue and a massive event that is much bigger than New Year's, World Cup, Olympic Games, anything that you can imagine? Is there any specific recommendation? Secondly, why is it that the world has only one company producing dengue vaccine? Where is WHO in the mobilization of private sector, etc., in the production of vaccines? Third, on the numbers, can you repeat again the numbers of 2024? I think you said 370,000 cases and 258 in Brazil. From where, when to when exactly? And finally, last question, is this a situation in Brazil that is a consequence of political choices in health during the years of Bolsonaro, or it has nothing to do with political choices? Thank you.
Thank you very much for a range of questions. So in terms of carnival, basically WHO has advice on personal protection. Mainly, we encourage people who are involved in the carnival to use repellents and protect themselves. And of course, those who are who can cover up with the long sleeves, it is even better. But repellents are definitely a way to protect yourself from day-biting mosquitoes. The second issue regarding in the companies producing vaccine, now you must remember that Takeda vaccine is the second one. The first one was Sanofi vaccine, which had limited efficacy because it works better in people who had dengue once. And Sanofi has since not been scaling up production, mainly because this challenge remains that they have to test anyone before they vaccinate. So it was the first candidate. The second is Q-dengue. Then, of course, we have a range of vaccines under trial, one of which is actually in Brazil, the Butantan vaccine, which is an NIH product which was licensed. And we understand that vaccine is giving real positive results, and we are waiting for their final report for recommendation. So there are candidates, and there are other candidates in other countries as well, all in various stages of studies. And we are encouraging it to come to the WHO Strategic Advisory Group for review and recommendation. In terms of dengue vaccine, the challenge is, basic issue is, dengue, there are 4 serotypes, or 4 closely related viruses. It is very difficult to find a vaccine which addresses all 4. And this has been the challenge for past 50 years. It is not an easy solution. So it is like having a single key for 4 locks. Not easy. So the problem is most of these vaccines have varying level of efficacy against these 4 viruses, 4 different closely related viruses. So if you want a good vaccine, we have to have at least 60-70% protection against these 4. And we are happy that some of these candidate vaccines are showing that. And we hope more vaccines will come in the coming years, and we are expecting 1 or 2 even this year, later this year. In terms of numbers, now the number I have is basically for the first 4 weeks of this year, and Brazil has 262,247 cases, and this was the number given to me, and we can give you the latest figure later because, as you know, our regional office Paphos has a website which is more or less live, constantly updated, so we can give you more accurate numbers. In terms of consequence, I wouldn't wish to comment on this because this health delivery system and how it is managed, it is very much a government priority. But I must say that Brazil has done commendably well for many, many years in addressing dengue, facilitating the introduction of vaccines, and even carrying out this large-scale vaccination right now. They have also been pivotal in testing new vector control methods. So there has been a lot of initiative from Brazil, and we look to Brazil's data mainly for many of our recommendations and things. We also have collaborating centers in Brazil. So overall, Brazil has done well, but we need more. And this is a very difficult disease because it's urban, and it is facilitated by a day-biting mosquito, and we really have 4 different viruses. So you may get infected in your lifetime with 1 or 2 or 3 of these. So this is our challenge, and we need to protect ourselves and make a comprehensive approach to deal with this. Thank you.
Thanks to you, Dr. Tariq, thank you for sending the notes. I think Jamil has a follow-up for you, Doctor.
Yes, very quick. You said that we may have 1 or 2 new vaccines by the end of the year. Which ones are they? And secondly, you mentioned the number for Brazil, 262,000, but what is the international number or the world number for that same period? Thank you so much.
Thank you. Actually, from the Brazil and the American region is one of the best we have in reporting. and their reporting system is something we are trying to develop in all regions of WHO, and we will launch a dashboard soon, we are under development. But the regions of the American region has really got a very good dashboard, which you can see on the website. Now, the global number is around 500,000 cases so far. But as I said, in the American region, because of their reporting, they account for 373,000 cases. Now, on the vaccine, we know that Butantan trial data is expected anytime this year. And we are also told that there is a trial going on somewhere in India also, and in few other countries, which the national regulatory authorities are screening. So we hope some of those candidates will also come to WHO later this year. So this is the data we have at the moment. Thank you.
Thanks to you. Further questions for Dr. Velayudhan? I don't see that's the case, so I'd like to take this opportunity to thank you very much for the important work and shedding light on this important situation of the global dengue situation, in fact. Okay, Catherine from UNCTAD has an announcement for us. Over to you, Catherine.
Bonjour, je vous invite à la Barbade du 21 au 24 mai 2024 à Bridgetown, la capitale donc de la Barbade. La CNUSED et le gouvernement de la Barbade organisent le premier forum des Nations Unies sur les chaînes d'approvisionnement. Ce sera l'objet de la conférence de presse à laquelle vous êtes invités mardi prochain, le 13 à 16h. Nous serons en duplex avec Bridgetown et dans cette salle vous aurez comme orateur le secrétaire général adjoint Pedro Manuel Moreno et l'ambassadeur de la Barbade auprès des Nations Unies et autres organisations internationales, l'ambassadeur Matthew Wilson. À Bridgetown, ce sera l'honorable ministre des Affaires étrangères et du Commerce extérieur, Kiri Simons, qui sera en ligne avec vous. Le transport et la logistique sont les piliers de la mondialisation. Ils relient les chaînes d'approvisionnement et assurent le transport, la diffusion des biens, le commerce mondial. Les chaînes d'approvisionnement, soutenues par des transports et une logistique durable et résiliente, peuvent favoriser la croissance économique, la création d'emplois et la réduction de la pauvreté. Elles sont donc très importantes pour atteindre les objectifs de développement durable. Pour autant, les changements climatiques et les événements induits qui sont souvent extrêmes, les tensions géopolitiques, les pénuries, que ce soit de carburant ou d'autres matières premières, des coûts d'expédition élevés, les tensions commerciales comme elles émergent entre différents acteurs de la mondialisation, une pandémie mondiale du type Covid-19 et l'impératif de durabilité qui nécessite des investissements importants posent des problèmes sérieux à une mondialisation durable et en croissance. Les pays en développement, bien sûr, sont les plus vulnérables face à ces enjeux et parmi eux, les petits États insulaires en développement comme la Barbade. Ils sont le plus durement touchés. On peut aussi mentionner les pays enclavés, les petits États enclavés qui n'ont pas d'accès aux ports, aux océans et mers. Il faut garder en tête que 80% du volume du commerce international passe par le transport maritime. Quand il y a un point de pourcentage d'augmentation des coûts de transport sur les prix, la hausse dans les petits États insulaires en développement, par exemple, est 5 fois plus élevée. Donc, ils sont vraiment très, très mal placés dans la carte mondiale du commerce international. Il faut donc les aider à faire face à ces enjeux, comme tous les autres pays en développement par ailleurs. Ça sera donc l'enjeu de ce forum où les décideurs politiques, les leaders de l'industrie et les gens de terrain discuteront de solutions innovantes pour relever les défis du transport et de la logistique et exploiter les opportunités de ces chaînes de valeur durables, inclusives et résilientes. Comment aider ces pays? Donc, on a dit c'était par des solutions innovantes dans le cadre d'une forte collaboration internationale accompagnée de partenariats publics-privés. Tous les acteurs doivent être sur la même longueur d'onde pour résoudre ces problèmes qui sont vraiment cruciaux. Voilà, donc je vais vous envoyer un lien. On est en train de faire des tests, on enverra le lien avant bien sûr mardi, et j'espère que vous serez en ligne ou dans cette salle pour suivre cette conférence de presse. Merci.
Merci à toi, Catherine. Questions for Catherine? No, I don't see that's the case. Thank you once again. Merci encore. We have just a couple of announcements in terms of the human rights treaty bodies. The Committee on the Elimination of Discrimination Against Women will be reviewing the Central African Republic today. And on Monday, the Committee on the Economic, Social, and Cultural Rights will open its 75th session, which will last for 3 weeks, during which the committee will review reports of Romania, Mauritania, Ireland, Iraq, Indonesia, and Sweden. There's a media advisory that was shared with you earlier. Vous avez reçu toutes les informations sur les conférences de presse mardi prochain for CNUSED. And then just the last note is a couple of observances, which I'd like to flag. Tomorrow is the Lunar New Year, and there's a video message from the Secretary General, through which he says he sends his warmest greetings as we usher in the year of the dragon. The dragon symbolizes energy, wisdom, protection, and good luck, and we need these qualities to rise to today's global challenges. Indeed, we do. And then Sunday, we have the International Day of Women and Girls in Science. Among other things, the Secretary General notes that from climate change to health to artificial intelligence, the equal participation of women and girls in scientific discovery and innovation is the only way to ensure that science works for everyone. So those messages were shared with you. Any questions for me? Nope, I don't see it the case. So I wish you a very nice weekend and happy Lunar New Year.